Hi everyone, Dr. Boom here with Rising Stars Pediatric Dentistry and Orthodontics. Here to talk about tongue ties. What are they and do we need to do anything about them? So a tongue tie is often used to describe when the tongue is held down really tight from the bottom of the mouth. Oftentimes people think that it means you can't stick your tongue out very far. But actually, I want to spend some time to kind of break it down. So in the world of dentistry or oral health, we like to discuss these tongue ties as tethered oral ties. Why? Well, there's different tissues in the mouth that really hold your soft tissue, your cheek, think your lip, think your tongue, holds them down, and there's a purpose behind it. But for some people, it's held down just too tight. Sometimes you have them in your upper lip, sometimes your cheeks, and sometimes under the tongue. For all three of those, the terminology we call them is a frenum. It's a frenum, and that tissue can be tight. If it's too tight in the tongue, sometimes for people they have difficulty speaking, or speaking properly, or making certain sounds, or speaking quickly. For an infant, for example, if the tongue is too tight, sometimes they have difficulty with feeding, and they can't properly feed, they can't properly latch, they can't properly take down milk and nutrients, and have difficulty gaining weight. So these different frenum can cause problems, resulting in issues in which we call them tethered oral ties. Now, whether or not we do anything about it, that's a different question. So, whether or not we have to treat a tethered oral tie really doesn't depend on the anatomy. For example, we'll see patients from time to time who have a very tight tissue in the lip, tight frenum, or a tight tongue, but they can eat fine, they're able to speak just okay, they're making all the normal sounds, they're gaining weight if they're an infant, and no issues whatsoever. We don't have to treat those. So we don't treat based on anatomy, we do treat based on symptoms. So if there's any problems with an infant, for example, some examples of infant problems include hiccuping often, or they have a shallow latch around mom's breast or a bottle, or sometimes they fall asleep in the middle of a feed. Other kiddos, the lip can be a problem because it'll curl under when they're nursing or taking a bottle. Sometimes they have colic symptoms, reflux symptoms. Sometimes they're spitting up often, or you'll notice milk kind of leaking out the side of their mouth when they're nursing. These are all just varied symptoms that can indicate there's a problem with one of these tethered oral ties and that something should be done about them. So then the next logical question is, well, what do you do? So in order to treat these tethered oral ties, there's a procedure called a frenectomy. So a frenectomy. Different from a frenotomy. Frenectomy, frenotomy. What's the difference? So a frenectomy is basically when the entire tissue is removed so that you can gain better mobility. A frenotomy in medicine and dentistry, otomy just means partial removal. So at our practice, we like to do what's called a frenectomy. We want to remove as much of that tissue that's really holding down either the tongue, holding down the lip, so that way the patient can have a better outcome.